Well, as most women know, breast augmentation is the most popular procedure in plastic surgery, and it's certainly the most popular procedure in my practice. Probably around 400,000 women had breast augmentation in the last year. The procedure is designed to make the breast larger and more attractive in its appearance by placing an implant under the breast tissue. Well, most women can go back to work and resume relatively normal activities in about a week. Well, at first, you're not going to be able to lift anything over 5 pounds, and we ask that you keep your arms below your shoulders. In other words, you can't raise your hands above your head. So if you're trying to wash your hair, you're not going to be able to do that during the first week after the surgery. After that, you can wash your hair, you can shower, and you can do relatively normal activities. The follow-up is usually we see the patient in the office the next day. It's done as an outpatient procedure, and we see the patient in the office the next day and check them, make sure they're doing okay, see them the next week, take their sutures out, and then 3 weeks later they're ready to resume all of the activities that they normally did. I do that procedure if patients request it. I prefer to use the periareolar incision, which is an incision at the bottom of the areola. I think that, for me, that gives you a more natural looking scar. It's very hard to see the scar, and it's well concealed. Most women can. Most women are able to breastfeed. Most women have sensation in their nipples. Probably the risk of losing the ability to nurse is about 15% for all women who've never had, have never nursed before. Saline implants are filled with saline, which is basically salt water. And the silicone gel implants are filled with a silicone gel material. The gel implants have just been back on the market for about 2.5 years. And the saline implants have been on the market for since 1992. And so women are real comfortable with the saline implants. Their friends have saline implants, and they have a good track record. And the gel implants were taken off the market back in '92, and women are a little nervous about them because maybe they don't understand the gel implants, or they still think there's something that can harm them in the gel implants. Well, the study showed, we studied thousands of women and couldn't find anything about the gel implants that caused autoimmune diseases or any other diseases for that matter. So I think the gel implants are safe. Aesthetically, I think the gel implants are better because they feel like natural breast tissue. They're very soft, and it's hard to tell that you have an implant just by feeling and the appearance of the implant. Saline implants, on the other hand, they can ripple. You can see ripples at the bottom of the breast. Sometimes when the patient leans forward, you can see ripples at the side of the breast when they have saline implants. Most women, just about everybody who has saline implants, will notice that you can feel ripples at the bottom of the breast after they have the surgery. They are fuller, the saline implants are fuller, and they're tighter and they're firmer than the gel implants in most instances. Well, including the surgeon's fee and anesthesia and the implants, if you use saline implants, it's around $5,000, and if you use gel implants, it's about $6,000.